It is Nurses Day on WDHA, and I am so happy to be Zooming with Andrea Lotosky, who is the Administrative Director of Nursing at St. Clare's Health. It is wonderful to see your face.
Hi, Terrie. You too.
Happy Nurses Day. I
Thank
have to
you.
talk to you because last year it was such a different Nurses Day than
It really
this year.
was.
And I'm not saying that it was harder or easier, because I think there's just an evolution that has taken place with so many things being redefined and redirected for our nurses. You know, I love doing the Nurses Day Marathon broadcast because I'm the daughter of a nurse, and the sacrifices that you give up to be a nurse, the lifestyle sacrifices, the personal sacrifices are just insurmountable. People cannot imagine what they are. So for me to just give up extra hours during one day is so simple. But I want to rewind with you a year. How have things changed for nursing and our hospitals over the last year?
A lot. It's very different. It's very new. I think we're all relearning. Just not even in healthcare, we're all relearning. What's the new norm going to be? So for us at the hospitals, we're also trying to figure out the new norm, trying to rebuild, trying to build in services for COVID patients. A lot of these patients have lasting effects from COVID. So what services can we provide to help them through the recovery and health issues that they may have moving forward due to their COVID? So we're relearning. We're relearning at the bedside. Care looks a little bit different. There's sometimes apprehension, you know. So we're relearning like the rest of the world, just in a different way. Things just look very different. The acuity of our patients coming in now is much higher. We're seeing patients not coming in as early as they may have pre-COVID. Avoiding kind of hospitals, understandably, you know, with new advances through the pandemic, with a lot of telehealth services that were provided, you know, people are holding off coming into the hospital more than they were before. So when these patients are coming in now, our patients, I know it sounds silly because we're a hospital, but they're really sick patients. These nurses are taking care of an acuity that we really have not seen before. So we're relearning what our new norm is going to be in healthcare and in nursing as well.
And that doesn't surprise me, because I've done the telehealth visits and the simple things where you would say, you know what, I think I might have sprained an ankle. Maybe I'll head over to the ER and just see what's going on. You're right. There's a rethinking of a process of doing those things where, you know, you're probably more apt to go if, you know, for lack of a better phrase, your ankle falls off than you are for just a simple sprain of an ankle. And I would imagine that the level of stress is so much higher because everything is sort of on alert. And you made such a great point too, when you just talked about the bedside, the situation at the bedside. This has been a year where our nurses had to do so much more than ever before. I mean, you were always such a comforting hand to people who needed it in a hospital. There's nothing like having your nurse come in and take care of you, and you feel so comfortable with that. But there was such a distance between people, and it didn't matter if you were in the hospital for being treated for COVID, or if you were on, you know, my mother was on an orthopedic floor, but the nurses weren't coming in and out as they would normally probably do because of COVID. So there was such a different sense of a pattern of doing what you were doing in a hospital. And for the nurses this past year, I mean, to sit by people's bedsides when there is no family there, you know, the nurses would always talk to the family and, you know, make a small joke when people were coming and going. And that sort of all was gone as well. Talk to me for some of our nurses about some of that emotional fatigue that they felt, because I don't really call it mental fatigue, because, you know, I know that you do get tired mentally, but there's an emotional fatigue that has to come from that, from just sort of seeing so much tragedy and so many people worried day after day after day, even if it's not COVID that you have, but you're still worried being in that environment. What was the year like for our nurses there?
That was probably one of the biggest struggles for us as nurses, especially at the bedside. We get into nursing to save lives. We get into nursing, you know, for that compassionate care, being at the bedside, and everything that nursing is was kind of the opposite. Like, these patients were so sick, and we didn't have the families at the bedside to comfort them. And what I watched, I'm very proud of my St. Clare's nurses, my frontline workers. I get emotional when I talk about them. I went back to the front line to work with them, hand in hand with them, and it was an honor. I was so proud of them. And I continue, they amazed me every day, and they continue to. They took on all of these patients as their own family members. They grew attached to these patients. You know, your first thought might be that they avoided going into these COVID rooms. You see on the news and stuff, like doors closed, patients isolated into rooms. And my nurses kind of took a different approach. They were like, that could be my family member in there. And they were there for their patients. They developed relationships. They got to know their patients, their story. They kept those patients going. And I think sometimes the patients kept them going. You know, they would get to know the patients. These patients would come in and they would just start to deteriorate, sometimes over a couple of days, sometimes over a couple of weeks. So when these same nurses were coming in and out, day in, day out with these same patients, they developed relationships, not just with the patients, but with the families as well. We really used the iPad, utilizing FaceTime a lot. Thank God for modern technology and FaceTime. These nurses were in there FaceTiming these families with these patients all the time. I always say one of the things that I can say proudly with St. Clare's, and I'm sure many other areas too, is none of our patients passed away alone. Every patient had one of us with them in one way, shape, or form. They were never alone. These nurses truly took these patients on as their own family members. And there was a lot of attachment with family as well. Some of these nurses really got close to families throughout this entire time. We have had families come back to us post-COVID, which means the world to these nurses. But yeah, every day it was emotional burnout. It's just, you know, every day it was a new patient going, you know, not well. You know, yesterday they were laughing and smiling with the nurse, and they come in today and, you know, they're not there. They're in ICU now. You know, it's the emotional burnout was real, and it was daily. It was every day. These nurses made so many sacrifices. Some of our nurses, you know, they had young children that they sent with other family members so that they could be at work every day. That, as a mom, I mean, I couldn't even imagine, but they made those kind of sacrifices. They worked day in, no matter how exhausted they were, day in, day out, they were here. They worked extra shifts. And they willingly came in. They didn't want to let their other, you know, team members down, but they also wanted to be there for these patients. So they worked tirelessly through this entire pandemic, and they still do to this day. But that was the biggest thing, was their attachment to these patients and the families, and becoming these patients' family members, and loving them and caring for them as if they were their own. And that's kind of what sets our nurses at St. Clare's apart, is COVID or non-COVID, that's what we do. We really care for our patients like they're our own family members, and that really showed during the pandemic. They amazed me.
Yeah, I mean, you brought up such a great point, because we talk about the sacrifices that you make. And, you know, I always remember my mom was a very hardworking nurse, and, you know, she's still a nurse at heart, even though she's a retired nurse. Once you're a nurse, you're always a nurse.
Always a nurse.
Always a nurse. And, you know, there were many different holidays and things that my mom was not around for, because she was nursing and she had her patients, and there were weekend shifts and everything involved. But you mentioned sacrifices this year, and special sacrifices in being away from family members. I've heard from friends of mine that are in nursing who were living in a hotel, in a certain area of a hotel together, and hadn't been home or haven't seen their own parents in a year because they just didn't feel it was safe. So yeah, there were some sacrifices made this year that were unlike anything that we've seen before. Let's talk a little bit about positivity, though, and those bright spots for our nurses when you would see someone leaving the hospital after being there for, a really long period of time. Those, I would imagine, were the stories that would be able to sustain you to
Yes.
be able to get through that next week at St. Clair's.
Absolutely. That was when we got to that point where we were starting to discharge patients. And like you said, these patients were there for a very long time. It was amazing. I mean, we would all line up like you've seen in other hospitals. We played Here Come the Sun by the Beatles. And the nurses would, it meant the world to them to get that closure, to see that patient going home. Some patients that you would never think would be able to go home, wheeled out of the hospital smiling and crying and laughing and all the emotions. That was one of my favorite parts. That gave us, like you said, that drive to keep going, because we started to see the light at the end of the tunnel. We started to see these patients going home with their family members, or having to go to rehab facilities, but still being able to see family briefly before they go, but just knowing they're taking that next step to a full recovery. It meant a lot to the nurses when we were able to start doing that. There are some that were just very emotional. We had a candlelight ceremony in June just to honor the patients and our staff, a small little ceremony. And we actually had some of those patients come back to us.
Oh, that's awesome. How wonderful.
That was amazing and
Yeah.
touching. And these nurses to get that closure. And again, going back to becoming those patients' family members without skipping a beat. Those patients, those nurses, they hugged, they embraced, they were just, that was amazing when they came back, when we saw some of those
And you
faces.
need that. You have to have that. There has to be some of that, because it just can't be, that trudging into the trenches without any sense of, but it's going to be okay, at least for this person or for that person. So you need
Right.
that. So talk to me about, I want to talk about vaccinations. And when your nurses realized that there were going to be safe and effective vaccines, and when your nurses realized that after this year, they were going to be some of the first people to get these safe and effective vaccines, that must have been a real moment of triumph for you guys.
Yeah, it was. It was exciting. It was scary, but exciting all at the same time. A lot of emotions around the vaccines. But at that point, I know for most of our nurses, like you mentioned before, like a lot of us not seeing our parents or family members for a long time, and knowing that there was going to be that moment soon, that there was one step closer. It was a lot of us when we got our vaccine, very emotional. Like, it was just like, you know what, like it was, take that COVID,
Right.
It was a great feeling. A lot of nurses excited, and, and like I said, it was a lot of nervousness, excitement, but a lot of us were ready for it. Once you've lived through what we've lived through and seen what we have seen, there's no question. Give me the vaccine.
Absolutely.
So
Absolutely.
it was an exciting moment. Some waited a little while to get it, just that nervousness, but now they've got it, and they're happy that they did. And at St. Clair's, a good majority of our staff are vaccinated at this point.
Yeah. Well, I remember seeing the first, healthcare workers publicly that were getting it. It was just such a great feeling for them. And we all knew that we were going to, get our place in line, but it was just so awesome because of the year, that you guys, you ladies and men in nursing have gone through. So talk to me about the future of nursing and recruitment, because I think it's so important. We always have to recruit that next generation of people that we cannot live our lives without. And nurses are those people. What has it been like for you guys? Have you had people that, young people that have seen, the heroism in the nursing field and have said, you know what, I think this might be something that I want to try? Or have you found that the year that you've gone through has made it all that much more hard to get people to be able to make that kind of a commitment?
So I think right now we're in that it's much harder stage. We do have some new graduate nurses that we've recently hired, and they're wonderful. But I feel for them because they missed their whole last year essentially in their clinicals, which is the most crucial time in your nursing school, is at the bedside, is those last semesters, and they missed that. So we haven't seen where nurses like, I want to go to nursing school, I want to, be on the front line. We're not there yet. I think waiting to see how enrollment is. I think recruitment is going to be harder. Unfortunately, I think it's going to take us a while to get back. But I will say, when you have a passion for nursing and when you want to be a nurse, like I'm one of those people, I've always just, no question, that's what I wanted to be, was a nurse. I think if you have that in you and that's what you truly want to do, I don't think we're going to lose those nurses. I think we're still going to see them coming through nursing school. But it's going to be scary for a while for people. This was an unprecedented year. It was something, I've been a nurse for 20 years and I've never lived through anything like this. So even the seasoned nurses, it's kind of, we're all kind of rebuilding from it. So I think recruitment, unfortunately, it's going to be harder before it gets better. I'm an optimist, so I think that it'll get better. We just have to get through this patch right now. But if you truly want to be a nurse, you're going to be a nurse. It just may take a while for them to get back into, enrolling and getting back to school.
It's very interesting because people used to always ask me, are you going to be a nurse like your mom? And I always thought, you know what? I'm not good enough for that. I'm just not good enough for that. There's something inherently in a nurse that's not in every person. It's just a special kind of person. And I never felt I could live up to that expectation. I just never did.
Even when you are a nurse, there's so many different avenues in nursing. That's why nursing is so amazing to me. There are so many different things you can do in nursing, so many different types of nursing and kinds of nursing. And I'm an adult critical care nurse by trade. And even there's some fields of nursing where I'm like, I don't think I could do that. Like, I've seen the worst of worst with adults. I don't think I could ever do pediatrics. Your oncology nurses, there are so many different areas of nursing that even when you are a nurse, that you're like, I don't know if I can do that. So, but that is an amazing thing about the nursing profession. There's so many different opportunities and avenues that you can go in and different kinds of nursing. So it's, I'm proud to be a nurse. It's a great profession. I don't regret it. I wouldn't change it for the world. Even after this past year, I may have days where I'm like, but it's a great profession. So you'd be surprised. We've had some nurses that come out that were like, I really never wanted to be a nurse, but I didn't know what else to do. And then they end up being some of the best nurses. You kind of have to find your niche once you are in nursing and you graduate. You kind of find what you're meant to do. But that's why nursing is so awesome, is there's so many different opportunities and areas you can go into.
Yeah. And this year, I mean, God, you guys are forging ahead, even with all the PTSD, that I'm sure followed you from 2020 into 2021. So talk to me about 2021. Seems to now be a year where we're calming and we're just pulling back a little bit. So is there definitely a different sense in the hospital? Does there feel like there's, a different feeling, a more optimistic feeling? I know we're not over everything yet, certainly. But is there a more optimistic feeling looking into the future with some cases coming down and vaccines going up, with everybody's morale?
There is. I think, like I said, it's just the learning the new norm and rebuilding. There is optimism. I know our numbers here are starting to really go down again, which is exciting.
Yay.
There's a lot of smiling faces today. It's
excellent.
It's exciting for us. But it's, people are still, we came out of the big surge in the spring, and then we kind of calmed down in the summer, and then in the fall we had another really big surge.
Yeah.
So I think we're kind of coming, it was the fall into the early winter, and we're starting to come down for that. So I think there's still, there's apprehension in a lot of us. But I think, as you mentioned, now with the vaccines, things are getting better and we're seeing it getting better. So I think we are optimistic. I think it's just, what is the new norm going to be?
Yeah. And a cautious optimism, because you saw when the cases surged and then we came down and then they surged again and then they started to come down, and everybody is probably feeling like there's no way I am living through. And we hear things like the third wave, the fourth wave, and, we're hoping a cautious optimism that we're over that hump now and things will start to turn in the right direction and stay in the right direction. So it's probably a little difficult at times to feel completely optimistic. So a cautious optimism, I'm sure.
Yes, it's a good way to put it. Cautiously optimistic. Yeah, because there
Cautiously
are days where
optimistic.
it's just, you just have those days. But for the
Yeah.
most part, we're cautiously optimistic. Like I said, it's exciting day here. Our numbers are down, the lowest they've been in a while.
Oh, that's great. That's
So,
great.
we take each day as a victory when we get it. So today's a good day,
Yeah. Yeah.
It's a
Today's a
happy
good
day.
day. And we all do this together. We all do this together. Our nurses can only do so much, and they have had a year like no other. And I hope you never have to live through a year like this again. I hope no generation of nursing and doctors ever have to live through what we've just lived through. But a cautious optimism for the future, and a brighter optimism for our nurses. And yeah, navigating a new normal and sort of a redirection of what the job of nursing is going to be in the future. Interesting and exciting.
It is. It is.
Yeah.
It is.
Sometimes obstacles, as I've often said, obstacles sometimes become opportunity.
Absolutely.
Yeah.
And, I think we've come out of this stronger. I think a lot of people realized they had more in them that they thought.
Oh yeah.
Um,
Oh yeah.
you don't realize what's really inside of you until you're put to the test. And like I said, my nurses were amazing, and they amazed me, and they still do. So we're very lucky. I can speak for St. Clare's. We're really lucky here, and they're the reason we got through it the way that we did. So, and our friends of nursing, our respiratory therapists, they were our right and left hands in
Oh
the
yes.
stuff. We couldn't have done it without them.
Absolutely.
There's so
Absolutely.
many, so many areas that came in to help. And then when you look at, talking about with the different areas in nursing, we have our OR nurses, our recovery room nurses, our same day surgery nurses. Their world got shut down. Surgeries got shut down. And what were they going to do? Well, what they did was they came out and they helped the bedside nurses. They came out, nurses that haven't never been at the bedside or haven't been there in a long time, and they rolled up their sleeves and they were there for us. PACU nurses coming out being ICU nurses, like so many different wonderful things that we saw during this pandemic. People just really coming forward, and no matter how scared they were, like, can I do this? I haven't done this in years. They did it, and they did it beautifully, and it was just amazing to see everybody coming together.
Andrea, the administrative director of nursing at St. Clare's Health, you and your nurses are our heroes.
Thank
Our
you.
absolute heroes, and we are so honored to have you with us again on Nurses Day on WDHA. It is so great to catch up with you. Thank you so much for taking the time.
Thank you for having me.
And please stay healthy, stay well. And I don't know what we would do without you guys and gals. You are the heart and soul of our hospital. So thank you from the bottom of my heart.
Thank you. I appreciate that. Thank you very much.